So I love this question because a lot of people, their understanding of healthcare is like Grey's Anatomy or like where there's like 30,000 doctors and there's like one nurse character. And I'm like, oh, no, that's not real life.
Yeah.
Real life is when you're admitted to the hospital, there's a nurse with you 24 hours. That nurse is your primary everything. When you need a medication, if your heart stops, if you stop breathing, if you have a medical emergency, it is the nurse who's there 24 hours. If you need CPR, it's going to be a nurse. There's going to be no doctors around. There's no doctors hanging out on the floor waiting. Let me just do something. Let me ambulate the patient. Realistically, you'll see your doctor maybe 5 to 10 minutes a day when you're hospitalized. And that's kind of just normal. They have a whole list of 30 patients they have to see in one day. And they got to just like go room to room and then make orders and put things, virtually in a computer and make their notes. But the nurses are the main detectives. We run essentially every floor.
So many. And it makes it hard for nurses and doctors, right, to deliver the level of and the quality of care that they want when they're having to think about these things, right? Like that shouldn't dictate how you.
And this is why the single-payer healthcare plan would be a fantastic idea.
Yes.
Nurses, we're so far removed from that, thankfully. Like if we're standing there and the patient's like, I want a gauze to wrap my, wound, or, the IV went bad and I go get another IV kit. We don't have to think about, does this patient have insurance? What will this get billed? We only are doing our best with all the supplies that we have. Now, maybe a physician who owns their own practice is going to be like, hey, don't overuse materials, or careful what I'm ordering. I don't want to just order tests that won't be covered. But thankfully, from a nursing perspective, I've never held back care or supplies or anything, thinking, actually, I don't even know if a patient has insurance or not. Like that's not part of the chart that I ever look at. There is a statistic, and this was pre-COVID that they did this statistic, that the majority of RNs will leave their profession, leave bedside within their first 5 years.
Wow.
40% will leave in the 5 years. That's crazy. Now, there is 250,000 new nurses graduating LPN and RN every year. So we do have people coming in and people getting licenses. You need to get those people to stay beyond 5 years. You need to.
And why are they not staying? Is that the burnout? Is that I'm getting too many patients assigned to me situation where I can't, I can't do it.
Yeah. I mean, to say it in a very, I'm not trying to make it flowery. I'm just going to say it. The environment is abusive.
Okay.
Patients are at their worst, and they sometimes will take it out on whoever is next to them constantly, which is the nurse. But because we're so worried about the customer is always right, upper management will not back you up and say, hey, you can talk to my nurses that way.
Is that they start looking at their patients like they're a machine that they need to fix, like a mechanic looks at a car, and they don't have, they kind of lose that human aspect to their whole interactions with their patients.
That's a great example.
I forget where I got it, but I saw something about that's how doctors get sued. Doctors who actually get malpractice suits against them, it's usually because they literally just don't know how to communicate right with their patients, and they don't treat their patients like humans. They treat them like machines, and it puts the patient off. And then if something goes wrong, they're like, this doctor sucks, I'm suing him. But if the doctor is human with them and something goes wrong, they're like, oh, well, he did his best. You know what I mean? Like it's that mental dynamic. Yes. The way the doctor approaches the patient has so much to do with the patient outcomes in so many cases.
For yourself, really understand your own diagnosis and your own options. Don't 100% rely on your provider for information, and don't always just, blindly do what they say. Do a lot of research, get a lot of opinions, and then sometimes you have to come with a plan to your provider and say, okay, I researched this. Surgery is a possibility for this benign tumor on my optic nerve, but I've also seen this. I want to try both options. Sometimes coming to the provider with a plan and not just sitting in front of a white coat and be like, tell me what to do. Researching your own diagnosis is super duper important. And there's so many tools now where you can literally put in your radiology scan and your labs into like AI and your symptoms, and it can kind of help you with all your options. And then for nurses, please give us grace. Like, we're really not sitting at the nurse's station, eating chocolate, scrolling on TikTok, not wanting to see you. And as we're like almost to the middle-ish of the hallway, all the lights turn off
Oh,
and then they
no.
flash back on. And then the CNA that I was with screams. There's a footprint in the middle of the bed, a man's footprint in the
I
middle
just
of
got full body. Oh my God. I have like full body chills right now. Sorry. I literally I have goosebumps from like my ankles all the way to my neck right now.
Yeah, I got tingly. Even I got
yeah.
tingly, and I host a
Wow.
paranormal podcast.
But then we were so busy
I'd
that
scream.
we're like, oh my God. I never went back into that hallway the entire time that I worked at that hospital ever again. But we were in such a rush. We just go back to the floor, we smooth out the bed, next patient came, and we just moved on.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut